British Prime Minister Boris Johnson. It says the UK needs to prepare for a tidal wave of Omicron cases.
The UK has confirmed the world's first coronavirus death linked to Omicron. The Health Secretary has warned that the variant is spreading at the most rapid rate ever seen and is set to become dominant in London by Wednesday.
While Omicron cases in Australia are still low, it won't stay that way. Of Sydney's 804 cases reported today, 85 are Omicron.
However, we are expecting those case numbers to increase over coming days as the genomic sequencing is performed to confirm that they're Omicron. And we are of the belief that Omicron transmission is accounting for our increased case numbers at present.
High vaccination numbers are keeping hospital admissions low, with 168 people currently being treated for COVID and 21 in intensive care. Overseas, Omicron is spreading fast, especially in parts of London and Europe. In Denmark, which opened up completely in mid-September, they're predicting they'll soon have 10,000 cases a day, mostly of Omicron, and that's in a population of just 5.8 million people. Because Omicron partially evades the immunity from past infection or vaccination, we're all potentially vulnerable. The impact of such surges around the world critically depends on how virulent, how dangerous Omicron is in terms of disease severity. In South Africa, a couple of weeks ago, it looked as though young kids were the ones particularly at risk.
Doctors in South Africa, where that variant was first detected, say they've seen a dramatic rise in the number of children under the age of 5 who need to be hospitalized as a result of Omicron.
With any new variant, a lot can happen in the first weeks before the picture clears. But already, children's hospitals around Johannesburg are seeing a pattern.
COVID treatment areas are full, but they're largely full of patients who are reasonably well, whose positive test results seem to be incidental in that they're asymptomatic, which feels quite different to the previous waves, in that at those times, even when our COVID treatment areas were full, they were full with patients who were a lot sicker.
This pattern seems to be similar to what's happening among South African adults.
Looking at the proportion of cases admitted, it's lower than it's been before. And looking at the actual hospital admissions who've already had an outcome from the hospital, they have had less severity than we've seen previously in the pandemic in terms of the need for oxygen, ventilation, or treatment in ICU or high care. However, it is early days and we don't yet want to make pronouncements on severity because it does take time for outcomes to accumulate.
This could still be misleading, but it's good news so far. Hospital cases are mostly the unvaccinated and children who haven't been exposed to the virus that much, which suggests the mildness is in the virus itself rather than people having background immunity. It is a reminder, though, that getting 5 to 11-year-olds immunised is as important as ever.
Parents are very keen to get their children vaccinated in the most part, but they want to be reassured about vaccine safety.
We can look to America for that, where the Pfizer vaccine has been rolled out for children 5 and over since November.
The Pfizer vaccine clinical trial was not large enough to be able to provide any information on the risk of myocarditis in 5 to 11-year-olds. But now, with more than 1.4 million kids who have received 2 doses, there has been no vaccine safety signal to show that there may be an increase in this age group.
Professor Margie Danchin from the Murdoch Children's Research Institute is helping to design a children's rollout that makes it as easy as possible for parents, at least in Victoria.
All children will be able to either go to the GP, a pharmacy or a vaccination hub, and then there'll be other tiers that offer more support, particularly for children who may have mild anxiety about immunisation or behavioural difficulties, or children with disabilities who need low sensory environments, such as kids with autism.
With cases surging in New South Wales and Omicron spreading in the background, anxiety levels could rise over Christmas. So, learning from South Africa, how panicked are their experts on a scale of 1 to 10?
I'd rate the situation a 5. I think we are steadily accumulating evidence around the characteristics of the variants.
and people were very, very anxious because we didn't really know what to expect. Whereas now we're probably somewhere in the middle where we know there are lots and lots of cases. We know community transmission is rife, but we're also hopeful that the early reports of mild disease turn out to be real.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.